Hi everyone, this is JP Singh. I welcome you all on my channel Medico's Maharathi. Hope you all are happy and healthy. My dear friends, our today's session is very special session for FMG exam students, and this session is also very special for NEETPG exam students. So this session is targeting both exams, and this session is named as short image session, my dear friends. And here we are going to cover up many images. We are going to see many images in very less time. So here we are going to start our this session, and I will also give you many links in the description of image based videos. So go through those videos also. Okay, 7 to 8 videos total, and these videos consist of important images, my dear friends. So I hope that you will also watch those videos in 2x speed. You can watch because all are helpful videos. Here we are going to see some amount of 45 images. So here we are starting our today's session with very basic anatomic image of brain, and the important thing to note down here is Sylvian fissure. Okay, Sylvian fissure, you must know about this structure, Sylvian fissure. And I think about lobes, you know very well: frontal lobe, parietal lobe, central sulcus, okay, occipital lobe, and cerebellum, temporal lobe. Next image is a little detail image. There we will see 2 to 3 PYQ which are already asked in past year. Here you can see fornix. Okay, first PYQ and asked many times fornix. Okay, after fornix you can see corpus callosum, septum pellucidum, thalamus. Here third ventricle. After third ventricle, posterior commissure. Here optic nerve, below, just below optic nerve, that is optic chiasma. Next to anterior to optic chiasma there is hypothalamus. Below hypothalamus you can see hypophysis, that is pituitary gland. Okay, cerebral peduncle, that is mesencephalon. Here you can see this is cerebral peduncle, pons, medulla oblongata, mediana spinalis, and here you can see fourth ventricle. Okay, cerebellum, cerebral aqueduct. Okay, the duct which is connected by cerebellum. Okay, cerebral, and here you can see cerebrum, pineal body, massa intermedia. So here the important things which are noted to down: one is choroid plexus, next to choroid plexus that is fornix, corpus callosum, third ventricle, fourth ventricle, okay, and optic chiasma. These location you must know in this image, my dear friends. Now let's go to next image. Here we go. Here you can see the anatomic part of hand. You can see different phalanx, distal phalanx, middle phalanx, but the important thing is that this part of bone, this is hamate, this is triquetral. Okay, after that you can see radius. Here you can see lunate, scaphoid, capitate, trapezoid, trapezium. So you must know about these bones, that in hand which bone is where. You know very well, but before exam you must know. Okay, sometime you can get mistaken also. So this is important image here. Let's go to next image. Here you can see the muscles present here. This is one of many times asked lumbricals, already asked in every exam, in NEETPG also, in FMG also, that this muscle present between the metacarpals, that is lumbricals here. Okay, you can see lumbricals, and here you can see adductor pollicis. Okay, there are chances to ask these muscles: abductor pollicis brevis on the upper part of the thumb. Okay, this side in the adductor digiti minimi, flexor digiti minimi brevis. So you must know about these muscles, my dear friends. Here you can see the anatomic part or anatomic view of foot, superior view. Okay, in superior view you can see talus, trochlea of talus, calcaneus. This question is asked in exam, and regarding cuneiform is also asked. Here it is on medial cuneiform, intermediate cuneiform, lateral cuneiform, cuboid, navicular bone. Also question asked regarding navicular bone, my dear friends. Okay, here you can see facet of medial malleus talus. Okay, this is medial view, and here portions are also shown, phalanges, then metatarsals, then tarsals. Okay, my dear friends. So you must know about their medial lateral view. You must know about the bones. Which place is for which bone, my dear friends? Navicular and cuneiform, intermediate cuneiform and navicular are already asked in exam. So this time examiner what will ask or will not ask, don't know, but it's our duty to discuss this image. Here you can see lateral palatine nerve. Okay, about nerve, there is question asked in previous year. Okay, medial calcaneal nerve. Okay, here lateral calcaneal nerve. Okay, plantar fascia, it is intrinsic muscle, and on this side you can see extensor retinaculum. Okay, extensor tendon. Okay, peroneus, a longus tendon. Okay, you can see peroneus, calcaneus, and then you can see longus tendon, peroneus brevis tendon. Okay, sural nerve. This is asked in previous year, my dear friends. Here, sural nerve, about related to sural nerve. So this question is also asked. So you must know about this image. Now let's go to our next image. Here you have to choose correct option regarding given life cycle. Here you can see bird stage, human stages. Okay, and here examiner given you that epimastigote in gut, multiply in midgut, and trypanomastigote. Okay, so you have to choose correct answer regarding this life cycle. It is a two-phasic life cycle, and this life cycle is representing option number A, that is encyclostomiasis. This life cycle is of encyclostomiasis, my dear friends. Let's go to next life cycle. Here you can see one stage is of mosquito, one stage is of human. Okay, and here examiner is asking the correct option for this life cycle. What do you think? What is this life cycle representing of? This life cycle is of Wuchereria bancrofti. This life cycle is of Wuchereria bancrofti. Here you have to choose again what this life cycle is representing, where dog is definitive host, sheep is intermediate host, and human is also playing role in a life cycle in between. So my dear friends, here the correct answer will be Echinococcus granulosus. Echinococcus granulosus. This life cycle is of Echinococcus granulosus. So here you can see another life cycle, my dear friends. Here the rat is playing an important role, and the waste material of rat, which is somehow going to human, circulating, and again going to another organism. So my dear friends, you have to tell here correct answer, and the correct answer for this life cycle will be Hymenolapsis nana. Hymenolapsis nana. This life cycle is of Hymenolapsis nana. So my dear friends, what do you think, what will be the answer for this life cycle? Here you can see pig also, human also. Okay, and now snail also. So what do you think, what will be the complete proper answer for this life cycle? The correct answer will be Fasciolopsis. Fasciolopsis. This life cycle is belonging to Fasciolopsis. So here you can also see the life cycle is rotating around snail and human, and here you have to tell again the correct appropriate answer for this life cycle, my dear friends. And the correct appropriate answer for this life cycle will be Paragonimus westermani. Paragonimus westermani. This life cycle is of Paragonimus westermani, my dear friends. And here you have to spot the X very properly, the structure very properly, and the correct answer for this both structure will be, this is of Balantidium coli. This structure belong to Balantidium coli, and this structure is belong to Isospora. Isospora, my dear friends. Another image spotter for you, my dear friends. Here you can see the first image is of Giardia lamblia, second image is of Cystosoma mansoni. So first image is of Giardia lamblia, and second image is of Cystosoma mansoni. Here you can see the correct labeling of both of these images, my dear friends. And here you have another two images, something like gold. Here you can see. So my dear friends, the first image is supporting Ascariasis lumbricoids, Ascariasis lumbricoid, and second image is of Enterobius vermicularis, Enterobius vermicularis. Now friends, here we have some of the special stain for calcium. You can use von cosa stain, black color of calcium. So C से calcium के लिए कैसा कलर है, black color. Stain कौन सा है, von cosa. Algerian red stain, road stain, and calcin stain. So calcium के लिए तीन stain है, von cosa, Algerian red stain, and calcin stain. For mucin, here you have Alcian blue stain. For myelin, Luxol fast blue stain. For reticulocyte, new methylene blue stain. For fat or lipid, oil red or Zn stain. For iron, you have Prussian blue stain or pearl stain. For melanin, you have Mason Fontana stain, which is giving black color, stromal stain, which will give blue green color, my dear friends. And here you can also see in images von Cosa stain for calcium giving black color. Okay, Alcian blue stain giving blue color for mucin, and Mason Fontana stain for melanin, oil redo stain for fat or lipid. Here you can see the red particles. Okay, and this stain is oil redo stain. And here we go, Prussian blue stain for iron. You can see these blue particles, blue areas are of iron, my dear friends. Here you can see note down appearance of iron. And here you have to think the correct answer according to this image, that what this image is representing of, my dear friends. Here in this image you can see this is raindrop skull, and raindrop skull, this is spotifying us here many drop like structure, and the structure is of multiple myeloma. Raindrop skull appearance can be seen with patients suffering from multiple myeloma. And here the same image also, here you have to choose the correct answer regarding this image, and the correct answer for this image will be pepper pot skull. Pepper pot skull can be seen in two things, one is multiple myeloma, and other thing it can also be noted down in hyperparathyroidism. Okay, it can also be noted down with multiple myeloma, and it can also be noted down with hyperparathyroidism. Spotify proper diagnosis according to this image. So this skull image is representing something like crew cut. So my dear friends, the correct answer for this image will be crew cut sign or hair on end. So the diagnosis will be crew cut sign. Spot proper diagnosis. According to this skull image, you have to spot out proper diagnosis, my dear friends. What you can note down here in this image, my dear friends, you have to tell the correct diagnosis, and the correct diagnosis will be empty delta sign. Empty delta sign, my dear friends, and this empty delta sign can be seen with condition intracranial dural sinus thrombosis. It can be seen with intracranial dural sinus thrombosis. And this image is of myelin figure, something like onion peel appearance. Okay, it is looking like something like onion. Okay, and myelin figures, generally these are derived from cell membrane, my dear friends. myelin figure कहाँ से derived होती है, cell membrane से. Next image, here you go, this image is of coagulative necrosis. Here you can see the structure is of kidney, and this part, this area is of dead tissue, and the structure is representing here coagulative necrosis. And here this mark structure are ghost cell. Okay, and this appearance is tombstone appearance, which can be noted down with pemphigus vulgaris, my dear friends. Another image is of liquefactive necrosis. Here you can see the proper image, liquefactive necrosis, or you can also say it as colliquative necrosis, my dear friends. So here you can see this image is representing gaseous type of necrosis. And if examiner is giving you here two option, liquefactive and coagulative necrosis, then more will be chances for coagulative necrosis, less will be for liquefactive necrosis, my dear friend. Here you can see the image of fibroid necrosis, my dear friends, and fibroid necrosis can be noted down with many things like PAN, okay, polyarteriosis nodosa, SLE, and many other things also. But the important one is that is PAN, polyarteriosis nodosa, my dear friends. And here you have the gel electrophoresis given pattern of patient B. Here in patient B you can see step ladder pattern, which is most common with apoptosis, and in C you can see smearing. But the step ladder pattern, it is most commonly seen with apoptosis, but it can also be seen with necrosis. So here correct answer will be both. And the C pattern is of smearing, which is most commonly seen in necrosis, but here we can see step ladder pattern in both apoptosis and necrosis, my dear friends. Here you can see the different stain. Okay, stands for melanin Mason Fontana stain. Melanin MC Mason Fontana will give black color. Stromal stain blue green. Immunohistochemistry HMB 45, that will give brown color, my dear friends. And here you can see this is Prussian blue stain or pulse stain, which I already shown you for used for iron. And here you can see Sala and Klima needle. Okay, you can remember it by Klima by L. Okay, Klima का L देखो, और यहाँ पर देखो लॉन्ग एक्सिस नेडल है ये, और यहाँ पर सहला निडल है तो सहला का एस देखो, और यहाँ पर क्या है ये साइड बोर निडल. ओके, and this is the Jamshidi needle. Okay, Jamshidi needle used for bone marrow biopsy, my dear friends. These are Jamshidi needle here. Here examiner given you three cells: bite cell. Here you can see bite cell, sickle cells, teardrop cell. I think you can easily note down these cells, my dear friends. And these cells have some another name like bite cell. It is also said as degmacyte. Sickle cell, it is also said as drepanocyte. And here we go to next image. This is intracytoplasmic body, and that is Russell body, that is intranuclear body. Okay, nucleus के अंदर, that is Dutcher body. Here you can see moat or mulberry cell. This is moat or mulberry cells. You can note down it very well, this cell, and in this little more cells. Okay, this is मोट सेल और मलबेरी सेल्स. ओके, अगर न्यूक्लियस के अंदर है इंट्रान्यूक्लियर तो डसर बॉडी, साइटोप्लाज्म के अंदर है तो रसेल बॉडी, माय डियर फ्रेंड्स. And another cell is fagot cell, that can be noted down in AML M3 condition. This is image given of fagot cell, my dear friends, and this can be noted down with AML M3 condition. Here examiner given you two images, my dear friends, and this is also a steroid body image. Here you can also see a steroid body image. This image is seen in condition Rose Gardner or Sporothrix, my dear friends. This is associated with Rose Gardner or Sporothrix, and this image, it is associated with condition sarcoidosis, my dear friends. Both are asteroid body image. And next image is of asbestosis body. Asbestosis body, this here you can see note down asbestosis body. And the stain which is used here, it is pearl stain or Persian blue stain, my dear friends. And here you can see keratin pearls. These the layers which are seen here, pearl like appearance, that is keratin pearls, and it can be noted down with squamous cell carcinoma. So this condition is of squamous cell carcinoma, and this appearance is keratin pearls, or stain is named as keratin pearls. And here two important markers are P40 and P63 in squamous cell carcinoma. So this image is of choriocarcinoma, that is representing here HMG necrosis, my dear friends. This image is associated with choriocarcinoma condition, and this is HMG necrosis, my dear friends. So my dear friends, here you can see teratoma image. This is ovarian teratoma. Here you can see note down tooth-like structure and also some hairs. And this turbans is here said as Roktinsky protuberans. This turbans is here said as Roktinsky protuberans, and this condition is associated with ovarian teratoma, my dear friends. And here you can see putti kidney. This structure is putti kidney and it is associated with TB, and it is also representing a condition that is caseous necrosis, my dear friends. Here in this image you can also note down putti kidney, my dear friends. And this kidney is leather green kidney. This kidney is leather green kidney, and it is representing benign hypertension. It is representing benign hypertensive condition, my dear friends. This is said as leather green kidney. Here this image is representing condition IgA nephropathy or Buerger's disease, my dear friends. This condition is representing IgA nephropathy or Buerger's disease. If there is IgA1 nephropathy, that is can be noted down in kidney mesenchyma, my dear friends. So this is all about our today's session. I hope that you all like this session. If you feel that this session is very helpful, then don't forget to like this video, share this video, and you can subscribe to my channel for future updates. And my dear friends, check the description of this video, because in description I'm going to give you links regarding image videos. There are 7 to 8 videos, each of 10 minutes. It will take your 10 to 20 minutes if you will watch all this video in 2x speed. And also there are some of the 4 to 5 videos of special stains, so also go through special stain videos, my dear friends. So I'm providing you link in the description, so go those links in 2x speed, my dear friends. So thanks to everyone, stay safe, stay healthy.